So thyroid eye disease is a kind of a rare autoimmune disorder that typically affects the eye and the orbit, and it enlarges the muscles and the fat around the orbit and often causes problems with vision and with appearance. So it's something that's often progressive, and we want to try to make a diagnosis early. Thyroid eye disease is definitely more common or most common among patients who have hyperthyroidism or Graves' disease. In fact, almost 50% of patients with hyperthyroidism actually will develop thyroid eye disease symptoms. But it's really important to understand that there are other categories. Patients with Hashimoto's or even patients who are hypothyroidism can also develop thyroid eye symptoms. Women are more likely to develop thyroid eye disease than men, but when men get it, their symptoms are much worse and more aggressive. And I would be remiss if I didn't say something about smoking. Smoking increases the risk for hyperthyroidism and also makes the symptoms worse for thyroid eye disease. So if you have a thyroid abnormality, especially if you're hyperthyroidist, if you're a Graves' disease patient, but also again if you're hypothyroid or Hashimoto's patient, and you have symptoms of dryness or irritation or double vision, you really want to seek out a specialist. And a specialist relates to thyroid eye disease. That would be an oculoplastic surgeon or an eye plastic surgeon, sometimes a neuro-ophthalmologist. I think a lot of times patients may not convey the right keywords to help the physician make the diagnosis, so it's important not to withhold or edit the symptoms that you're experiencing so that the provider that you're going to can help you make the diagnosis. You need to be fully candid. You need to explain the symptoms that you're having in terms of your vision and appearance and your quality of life and how it affects you, so that they have all of the information available, because it sometimes can be a difficult diagnosis to make, and if you withhold any of that information, it can lead to a delay in the diagnosis.